While the majority of blood tests require venous blood specimens collected with a needle and evacuated tube, some of the tests you're asked to perform may require capillary blood specimens instead. Let's examine the equipment and procedures necessary to perform these collections. The BD Microtainer Contact Activated Lancet is a safety-engineered device for skin puncture blood collection. 3 sizes are available. The BD Microtainer Contact Activated Purple Lancet designed for low-flow collections with a 30-gauge 1.5 mm needle. The BD Microtainer Contact Activated Pink Lancet, which uses a 21-gauge 1.8 mm needle to achieve medium flow rates. And the BD Microtainer Contact Activated Blue Lancet, a high-flow lancet, which employs a 2 mm by 1.5 mm blade. The BD Microtainer Contact Activated Lancet is activated only when it is positioned and pressed against the skin, and retracts automatically, minimizing the possibility of injury. This design helps to provide a standard, consistent puncture depth. Capillary blood is collected in specially designed tubes. BD Microtainer tubes with BD Microguard closure feature an integrated collector and a wide diameter tube to ease collection and improve the mixing of capillary blood. In addition, the unique Twist Assist Microguard closure features a recessed sealing plug with snap lock fit that ensures the tube is completely sealed and helps protect healthcare workers from blood exposure. Obtaining blood samples with the BD Microtainer Contact Activated Lancet is simple, but you'll want to spend a few moments to review its proper use. First, gather the materials you'll need. BD Vacutainer alcohol swabs or other alcohol prep pads. The appropriate BD Microtainer Contact Activated Lancets. And the BD Microtainer tubes required for the requested tests. Warming the collection site helps to stimulate blood flow, so ask your patient to wash his or her hands with warm soapy water. You may also choose to warm the site with a warm moist towel or other appropriate device. Select an appropriate puncture site, such as the middle or ring finger. After washing your own hands and putting on gloves, cleanse the puncture site using an alcohol swab or prep pad and allow the site to air dry thoroughly. Select the BD Microtainer Contact Activated Lancet that will provide the required blood flow. Twist off the protective tab, breaking the seal, and discard it in the proper container. Position the safety lancet firmly on the side of the fingertip of the ring or middle finger. Grasp the safety lancet securely between your fingers. To activate, press the safety lancet firmly against the puncture site and maintain pressure until an audible click is heard, signaling activation. The needle or blade permanently retracts after use. At your first opportunity, dispose of the used BD Microtainer Contact Activated Lancet in the nearest sharps collector. Wipe away the first drop of blood with a gauze pad and continue collecting the blood sample by positioning the BD Microtainer tube directly beneath the puncture site. Note that certain applications for glucose testing may not require wiping away the first drop of blood. Apply gentle, intermittent pressure on the entire finger to allow the capillaries to refill with blood and to help ensure continuous blood flow. Finally, wipe the site dry and apply direct pressure with the gauze pad until the bleeding has stopped. Mix all BD Microtainer tubes with the proper number of inversions.